Hi, everyone. My name is Grace Cheung. I am a physiotherapist and one of the clinic owners at Go Physiotherapy in Vancouver, BC. I wanted to introduce you all to Nushaba Islam. She's a physiotherapist that is joining our clinic in the new year, January 2021. So I thought I'd just sit down with Nushaba and get to know Nushaba a little bit so you guys, all of you, can also meet her as well. Hi,
Thank
Nushaba.
you for the introduction. Hi, Grace. Hi, everyone.
Thanks for meeting us here. Nushaba, you are just newly moved to
Mhm.
Vancouver. Can you tell us a little bit of where you're from?
So I moved here about, I guess, a month and a half ago to Vancouver from all the way from Toronto. So it was a huge move.
Big move.
Um, yeah, big move. But we just wanted a different pace of life and a new environment. And so far, we're loving it here. Yeah.
That's great. It's pretty cold right now. I think what hit minus
Yeah.
12. Are you used to that?
Oh, yeah. Even colder than that.
For
Yeah,
you?
absolutely.
Well, you've been a physio for 6 years now. Is that right? Am
Yeah.
I? Yeah. Can you tell us a little bit about some of your interests as a physiotherapist?
Yeah, absolutely. One of the things that I really am passionate about in treating is concussion and post-concussion syndrome.
Mm.
So it's just it allows you to be very creative in the way in the way you treat, and there's so much variety in every individual case with concussion and post-concussion syndrome, and yeah, it's very exciting.
Yeah. What type of people have you seen, like in terms of the concussion recovery? Have there been some interesting or more common cases?
Yeah. I've seen, concussion and post-concussion syndrome in both the athletic population, but more commonly in workplace injuries. It's a fairly common injury, and one of the goals is always to get people back to their function and get back to doing their job and things they love to do.
Yeah. When we chatted last, you mentioned a little bit about function, and you
Yeah.
mentioned something about setting up a sort of a functional task
Oh, yes.
in the
Yeah.
grocery store. I thought that was
Oh,
really
yeah.
neat. You want to
Yeah.
tell the people out there about
Absolutely.
that?
So one of the things that people will have trouble with, not everybody, but some subset of people, is scanning of the eyes after a brain injury. And so the way it kind of shows up is that when they go to the grocery store or they go shopping, when you have to scan the aisles, that becomes very difficult. They either become dizzy or they get a headache.
Mm.
And so to mimic that environment, I actually cut up some cereal boxes and other items and then pasted them on the wall to mimic the aisles of a grocery store. And that's one of the progressions we did to practice eye scanning. Yeah.
Nice. Yeah, it's nice to have some Lucky Charms and Life
Yeah.
cereal in there. Yeah,
Yeah,
everyday
exactly.
work. Yeah.
Keep all your recyclables handy.
Yeah. Um, yeah, that's really neat. Concussion, physio, and all the development around concussion
Hmm.
rehab has been really great because there's
Yeah,
so much of it happening that we're only just becoming a bit more aware of
exactly.
in the community and in sports and
Yeah.
um, youth as well.
Yeah,
Um,
absolutely.
so, Nishava, that's really neat. Concussion therapy. Is there anything else that you treat or that you are specialized in working with?
Um, I guess I treat a variety of orthopedic injuries, but another area that I'm really interested in is shoulder injuries.
Mm.
It's fairly common, not just in the sports population, but just day to day repetitive use. So it's very exciting to get people back to function as well.
Great. Thanks. So, Nishaba, regarding concussions, you were just telling me a little bit about bionasal occlusion. I don't know anything about that. I can guess, but can you tell us a little bit more about what you would do with that?
Yeah, absolutely. It's one of the treatments I do for concussion and post-concussion therapy. And what it is that after a brain injury, and this is just not with concussion, it's with any brain injury, like strokes as well, the ability of our brain to kind of process a lot of visual input, it's not as efficient. So, to make it so that there's less things, kind of less information going into our eyes and therefore our brain, what I do is, so I don't have the foggy tape,
Yeah.
but you can use like foggy nail polish as well. But the idea is that you tape off, and it really depends on what the person can tolerate. We kind of tape off the inner part of the glasses like that, so it would be foggy. And so when you look through it, the inner part of the vision is cloudy, and so there's less visual input going into your
Yeah.
eyes, and it's amazing because I've had people put the glasses on with the occlusion,
Yeah.
and they can read better. They it's not a straining on the eyes. It's just instantaneous. So sometimes I'll have people read a passage of a book before the occlusion and then after, and even they're surprised as to how smoothly they can read.
Wow.
It's magical. Yeah, it's
That's
pretty cool.
really neat. It
Yeah.
makes me think of a lot of different things, actually. It
Yeah.
makes me think of horses with blinders. It makes me
Yeah,
think of,
exactly.
there are these
Yeah.
glasses out there that are blackout glasses, and they have pinholes in them, and they
Oh,
actually,
yeah.
people use them to train their eyeyesight.
Yeah. That's
Um,
pretty interesting.
and it also makes me think of the kid that breaks his glasses and tapes up the middle
Yeah.
to make it function. But this is actually really
Yeah.
neat because you're actually doing rehab and
Yeah.
by
Yeah.
taking input away.
Yeah.
Really neat.
And then gradually you just kind of make the tape smaller and smaller, so there's
Huh.
gradually more input, and then eventually the goal is that you won't need the tape anymore. Yeah.
Very cool. Wow. So it sounds like, Nushaba, in your university and post-university graduate life as a physio, you've done some research in the universities. I thought it was really fascinating. Can you tell us, like, just a little bit about what you've worked with?
Yeah. So I did some research in Toronto during my undergraduate years, and the main premise of the study was about this drug that was used for cancer, but they were using it to see if it helps in cases of diabetes. So we were doing a bit of research on that. Yeah.
Very cool. Nushaba, can you tell us a little bit, just a hint of your personal story?
Yeah. So we moved here, as I mentioned before, from Toronto, because my husband, he actually works at UBC. So one of the cool things is we get to live in UBC right on the campus, which is pretty awesome. And I also have a 4-year-old, a little boy, who keeps me really, really busy.
Yes, I have met him on Zoom, and he's
Yeah.
a cutie, very bright kid.
Thank you.
Nice. All right. Well, thanks, Nushaba.
No problem.
All
Thank you
right.
for having me, Grace.
Okay. Bye, everyone.
Bye.